So we're back with Sam J, and we were talking about the COVID pandemic and all the crazy things that happened these past couple of years. So obviously, as we know, we ourselves faced a lot these past couple of years, and it's been really crazy. And sitting here brings back a lot of memories and what life made us go through. You want to talk a little bit more about that?
Yeah, I know from self experience we can talk about how we lost two family members in a span of three
Oh yeah,
days during the pandemic. It was crazy. We then had to move back to where they used to live, like around where they used to live,
yeah,
and having to drive by their
yeah.
houses and stuff like that is very hard for us. Even now. I wouldn't say that I've processed it
Oh
all,
yeah, talking about it now isn't any better than it was 2 years ago.
right?
Yeah.
But I definitely, I guess, try to put that behind us and, just, I guess, look, forward to the future. But yeah.
So now I guess you could say the first official question I have. A lot of people lost jobs during the pandemic. Now, there's no doubt that that was a great loss besides human loss. You want to talk a little bit more about that?
Yeah, no, so there's a lot of articles I've been reading in regards to the rise in percentage of unemployment
Oh yeah,
in different groups. So, although the pandemic had its own health disparities, I feel like it also had um, a lot of just different like things that people had to go through that till this day, it's hard to talk about. But there was, the during the pandemic, there was like the longest economic expansion in regards to millions of jobs being lost because some of them really couldn't be performed. We had
yeah. It was difficult as is for us. I can't even imagine for people who had like a lot of contact with their jobs and like physical contact and stuff like that. We had a job where we had to quickly pack people's food, but that was dangerous as is because we were in the middle of a pandemic. We would have to be fully covered. We had to do like almost daily health screenings. We had gloves on and we had to be super careful. We were risking it just as much as the people ordering the food were.
Yeah, and we were part-time workers, so there was like an article about the monthly labor review where literally talked about 29% of jobs literally being lost,
That's crazy.
for part-time workers.
Yeah.
So we kind of were a little lucky if you think about it that we even had a job during such a crazy time. But levels spiked, and that was literally seen throughout many different groups, not just one, different minorities and things like that. So that was very rough.
Oh yeah, for sure. Now that you touched upon the different groups and how in regards to the financial stability, you wanna talk a little bit more about that, in detail.
Yeah, so a lot of families were kind of left, a lot of people were left without jobs. So that can only mean one thing: you're not able to pay your bills, you're not able to pay your rent. And even though there were laws that were literally instated to kind of protect you, you still knew that at the end of the day you were going to have to pay something back. So, not having a job and having, actually not having financial stability, that was kind of hectic during that time. So a lot of people, most families were left technically on the homeless spectrum, which is very
Oh
sad
yeah.
to see because you started seeing single adults literally trying to find shelter in the streets. And during a pandemic, that's obviously not the smartest thing that you could do because you're easily prone to getting COVID. So that was very hard. Um, I was reading a lot of articles, in regards to New York City, because we obviously love to go to New York a lot.
Yeah.
But the homeless rates there were crazy. It skyrocketed, especially for single adults. Um, but a CBS News article kind of talked about how families, thankfully, were not as impacted because they were protected by that law. So it was very difficult to do that. But a number of people then started running out of food. Obviously, um, if you have no money, you can't buy food. You can't have,
Yeah.
provide that shelter for yourself. So a lot of people, in regards to the World Bank Group, there was food insecurity and a lot of it during COVID-19. So, people started running out of food in over 72 countries, and that's crazy. So there was, reduced calorie intake. There was, compromised nutrition that started to threaten people's health. So that's kind of crazy. And then you're just gaining poverty, from that. And soon enough, people, are going to be left homeless. So that was, some lasting impacts, it also leaves lasting impacts in the development of, young children because, food insecurity. The higher retail prices combined with like reduced incomes,
Yeah.
that's just cause for disaster. So, households are having to cut down the quantity and quality of their food consumption. So there can come in, different health problems from there. So it was a really rough time, COVID-19. But, some people made it out alive, and I think that is the most important thing. In regards to food and stuff like that, essential services, I feel like some people did gain some types of jobs in regards to that because people didn't want to go
Oh
out
yeah.
anymore. They wanted their food to be brought to their house, and that's kind of where we fall in. We had a job where we had to kind of shop for other people, so we kind of had I guess a decent job during that time, and something that people were really in demand for. So it's crazy because from there, a lot of people were hospitalized. A lot of people had to go to the hospital, and many minority groups couldn't
Yeah.
because of the fear of not having health insurance. They thought, they're not going to help me. They're just going to send me back home, or other people who literally didn't understand the concept of COVID, and that's, I guess, educational wise, it's a lot of people didn't know what we were going through. They kind of had like a little, I guess, an imagination of what it could be, but they weren't certain of what we were going through. And it's understandable for different groups, and there's actually an article that I was reading about that as well, about racial and ethnic health disparities, in relation to COVID-19. And it's, a lot of people were affected. And even though people were being hospitalized, they still didn't know what they were going through. And a lot of people were also put at risk because of hypertension. And again, this goes with a lot of minority groups. Hypertension, people who are prone to diabetes, obesity, those people were more, at risk. And that's crazy to see too. People with, no English proficiency,
Yeah.
they kind of had a limited literacy about, like what to understand about COVID. So if you went to a hospital where there was no one who spoke Spanish or another language that, was your main language, then you kind of had this problem of like, translation and what you were understanding about your health. So that was a huge thing during the COVID-19 pandemic. And the public health information that we get now, you can see that being reflected, and you have to try to understand and see, what people, different minority groups had to go through during that time. But at the same time, you know there's a lot of factors that contributed to COVID-19. A lot of people, didn't want to follow different rules, didn't want to put up their mask, didn't want to sanitize, and we saw that with a lot of, mortality. And even though we were witnesses to that, firsthand, we we now know that we should have done things differently. The government tried to implement different laws. Now there's vaccine mandates, trying to be implemented so we can I guess, have a higher percentage of people that can survive this pandemic. And, we just have to keep, going, I guess, and not look back, you know? But yeah, thank you so much for your time, Sam.
No, thank you so much.
Thank you.